Hello, welcome back. The topic today we are going to discuss is about PCOD, that is Polycystic Ovarian Disease, or PCOS, Polycystic Ovarian Syndrome. It's a disease of the women because it happens only in the ovaries. What is that? Why it is very important? It's important because it's one of the main reasons for weight gain in women. It's also one of the main reasons for metabolic syndrome in women, and is also one of the reasons for infertility in women. Okay, what is that? What is PCOD? What is Polycystic Ovarian Disease? Poly means many, cystic means cyst, small cyst, water-like bubbles, cysts, ovary disease. This is called Polycystic Ovarian Disease or syndrome. Okay, all women have their two ovaries, right and left. These ovaries produce egg, that's called ovum, that is being released every month. The monthly cycles, they release egg. The ovum has a function of secreting hormones, especially female sex hormones, and with a tiny amount of male sex hormones. Okay, in PCOD what happens is the ovum, which is from the ovary, is not released completely. The ovulation does not happen. The ovum is arrested. So what happens? The ovum is, instead of going into the uterus, it is there and it's live. So it's continuously secreting hormones. So every month, so many months, if ovum is not released, there will be so many ovums in the surface. They look like small bubbles, cystic appearance, like a sago grain. They appear. And they are alive, they keep on secreting the hormones. If the ovulation happens after some time, the hormone secretion is over. But here, the hormone secretion is not over. They keep on secreting. So not only the female hormones, what is the tiny amount of male hormone, the androgen, becomes little more. So the androgen secretion is more. Okay, what are the signs and symptoms that can happen? Usually, it happens in out of 10 women, 1 woman can get this PCOD, and it usually happens between the age of 12 to 45. Okay, how they usually know this they could have a PCOD? Usually the menstrual cycle is affected. They have an irregular menstrual cycle, or very few cycles, less than 8 or maybe 9 or 8 cycles per year. So less cycles, irregular cycles. The duration of the cycle, instead of 3 to 5 days, they may be prolonged cycles. They will be bleeding heavily. So these are the menstrual cycle symptoms, which usually the patient comes to know they have some issues. And also because of the androgen, the male hormone, they have the characteristics of male thing, like they have a thin hair fall. We call that male type of hair fall will be there. Acne will be there. Instead of the scalp hair, they have there will fall of scalp hair, but they'll have excess facial hair or body hair. The skin complexion get darker, and this really is the one which really makes the patient go to the doctor. They usually go to the dermatologist, then usually they find, or they go to the gynecologist. They also can find. Apart from that, they can also have metabolic syndrome. They can have insulin resistance. They have too much of insulin, but it's a useless insulin. So too much of insulin makes them gain weight, but it's a useless insulin, so they can also develop diabetes. And not only that, the cholesterol can rise, they can get hypertension, they can get heart diseases. And apart from these things, depression, the hormone itself or the PCOD itself can cause depression, or because of this facial hair, weight gain, irregular cycle, they can get into depression. So these are the signs and symptoms usually they can have. And this is one of the main reasons for resisting weight loss. So people, the women who go for a weight loss program or weight loss, it's very tough. It's very it's not easy to lose weight because of these hormonal changes and PCOD. Okay, what are the tests to be done? Okay, once you go to the doctor, either most of the time they go to the gynecologist, or sometimes they go to the dermatologist. The gynecologist, they'll ask the history, they'll do a physical examination, and they'll ask for a blood test and scan. Usually a simple ultrasound scan can pick up the polycystic ovary, the cysts in the ovary, and the blood test, like they can have anemia, or they may even sometimes they may even have thyroid issues, and they have the androgen, the hormone levels. The gynecologist will ask for the hormone levels. There will be a little higher amount of androgen. They may have a hyperinsulin level. These are the certain blood things that can point out to PCOD, or they may even have a infertility. Okay, so what are the treatment? How to treat? Okay, mostly their treatment is aimed for what is mainly for regularizing the monthly cycle, or infertility, or the skin problem usually, and it depends upon the age. Younger the age, usually suppose they are anemic, or they have irregular cycles and all, simple reassurance along with diet change and exercise, all these things are the one which is important. Where the first and foremost the treatment comes is the weight reduction. At least 5 to 10% of weight reduction is a must. Suppose somebody is 50 kg, they should lose at least 5 kg, because of the PCOD they gain weight. Because of the weight, the PCOD gets into complications. So weight reduction is the main thing. So physical activity, exercise, strenuous exercise, like aerobics, swimming kind of thing, exercise is very important, along with diet part. So they should cut down all sugar and fatty things, and they should improve their vegetables and fruits. Natural food intake should be more, and exercise should be more. Lifestyle, have a proper sleep. All these things is very important, first and foremost, whether it's young age or old age. The second thing, usually happens in the middle age group, regularizing the monthly cycles. So the gynecologist, they can prescribe certain medications like hormones. Usually the hormones which used for the birth control. These hormones, they can regularize the monthly cycles. And the next is aiming for the other things like acne, the pimples, or the skin complexion, or hair fall, or excessive hair. So the treatment is divided. The final is if very few people they'll get into infertility, and the treatment is aimed for the infertility. Again, most of the time, right from the lifestyle change, the diet, exercise, all these things, the hormone treatment. If they fail, there is sometimes the gynecologist, they do the laparoscopic ovarian cystectomy, or drilling the ovaries. The ovaries there, a lot of ovums, arrested ovums are there. So they do a lot of puncture, they drill that, so the egg can be released. This can be done. And from our side, from the bariatric surgeons, if all these measures fail, and because of the weight, infertility is there, because of the weight, depression is so high, so heavy, or because of these, the menstrual cycles are so erratic and so heavy, makes them anemic and makes their life miserable, then the bariatric surgeon can suggest bariatric surgery, gastric bypass, or sleeve gastrectomy to lose weight. When they lose weight, the fat level comes down, the hormone levels goes down, so they can get relief from the effects of PCOD. The insulin sensitivity increases. So PCOD is a very common disease. 1 in 10 women can get, and usually the age group of 12 to 45, and mostly they present to the doctor with irregular cycle, weight gain, facial hair, and depression. And if diet, exercise, lifestyle change, and medications fail, the bariatric surgery is strongly suggested to them to get the relief. So consult your doctor and have a clear picture about PCOD and get the proper treatment. Thank you.